And here is your stem.
Okay, ma'am.
Just 15 seconds left, please. Okay, so if you've read and understood, considering it history-taking station, please begin.
Hi, I'm Muhammad Ali, one of the exam candidate. May I confirm your name and age, please?
Yes, doctor. I am Steve, 64 years old.
Nice to meet you, Steve. Today I've been asked to ask you a few questions about your condition. Are you okay with it?
Okay, doctor, go ahead.
How may I help you?
Doctor, I have passing blood with my poop since the last 6 months. So seems it was started with constipation. So now is like fresh blood.
Did it start suddenly or gradually?
No, it's gradually since 6 months now.
Okay, and is it all the time when you go to poop, or there is some time when you don't have bleeding from?
Before it was with the poop, but now even not with the poop, it came sometimes itself without
Okay,
even stool.
you think the bleeding frequency is getting worse than the previous initial
Yes,
days?
yes, doctor.
Okay. Uh, do you have any pain while defecating?
No, it's not painful. It's most of the time it's painless.
Okay, and what's the color of the blood when you have this?
So it's mostly fresh blood. Sometimes it's clot.
Okay, and can you tell me what's the quantity, like a spoonful or a cup or more than
Yes,
that?
doc. It's a spoonful, big spoonful.
Okay, and can you please tell me how does it get better? Is there anything that you do it gets better?
No, now it's not getting better. It's getting worse gradually.
Okay, and can you please tell me, is there anything that you do which makes it get more worse?
Yeah, when I'm constipated, it's getting worse.
Okay. Uh, can you please tell me that have you noticed any change in your bowel habits?
Yes, doctor. I have changed in the bowel habit. It was like uh, constipation before, but now even not with constipation, it's just bleeding.
Okay, and have you noticed any unintentional weight loss or loss of appetite?
Yes, I have marked weight loss. Is we can say is more than 10 pound weight loss.
Okay, and have you traveled to any other country recently?
Sorry, your voice is echoing, though.
Have you traveled to any other country recently?
No, no, no,
Okay. Do you have the urge to defecate after you go to uh, pass the stool?
no,
Okay. Uh, do you feel any kind of itching or or any swelling around your back passage?
no,
Okay. And do you have bleeding from any other orifice of the body?
No.
Okay. Can you please tell me, have you been to a GP for any medical condition?
No, I don't have any other disease. So
Uh,
except that problem, I went
have you
to
had
visit GP once.
uh, have you had any surgery for any condition?
No,
Okay. Do you take any prescribed medication or over-the-counter medications?
no, doctor.
Do you have any drug allergy?
No,
Any allergy to any medication?
no, not that I'm aware of.
Okay. Now I would ask you a few personal questions. Can you please tell me what's your occupation?
I am a businessman.
Okay. And who do you live with?
I live with my family, my wife, my son.
Okay. And do you have any problem or difficulties while going upstairs?
No,
Okay. Can you please tell me if you smoke?
I had it before, but now since few years I stopped.
How many packs a day?
Yeah, maybe 10 cigars per day it was.
Okay. And do you drink alcohol?
Occasionally.
And how many units? Can you please tell?
No, it's very rarely, maybe like in occasionally two pack or something.
Okay. Is there any other member of your family who is suffering from the similar problem?
No.
Okay. Um, Now, what do you think is causing this problem?
Um, I go through the Google, so might be a cancer.
Can you please summarize your history now?
I'm a 64-year-old male. Have a complaint of bleeding from the rectum since 6 months, on and off, with occasional passage of blood clots. And patient also have a complaint, which it was sudden in onset, gradually progressive, getting worse with the time. And patient also have a complaint of weight loss, uh, and the patient is a smoker since 35 years and hypertensive. And the patient does not have any past history of any other medical condition or any surgery, no drug allergy, and there's no family history of any uh, medical condition.
Considering the
And
situation of the patient or the stem, what is the most important investigation that you will ask for?
in this patient, I would ask for sigmoidoscopy to look
Okay,
for.
if it's available, rigid sigmoidoscopy, if it's available, then
Uh, then I would also get biochemistry. I would get full blood count to check the anemia or to see the infective colitis causes or leukocytosis. I would also check patients' serum LFTs and urea creat to rule out any uh, a liver disease which may cause a variceal bleed. And I would also get ECG to check for any ischemic condition or any emboli or any atrial fibrillation which may cause any emboli. And I would also get uh,
okay.
orogastroduodenoscopy for
Considering this scenario, what are the differential diagnoses you'll keep in your mind?
considering this scenario, it could be mesenteric ischemia, rectal
Come on.
ulcers, angiodysplasia, colorectal cancer.
Colorectal cancer. Okay. Once you are thinking about the colorectal cancer because of the age and how the bowel habits has changed and how symptoms have occurred and the weight loss, you'll also, the most importantly, after sigmoidoscopy, you will consider colonoscopy with biopsy. And
Yes,
then
ma'am.
the remaining of the investigations that you have told me. Okay, good.
Yes.
Yes, could be hemorrhoids, could be even inflammatory bowel disease, diverticular disease, benign polyp even, or the anal fissures, could be anything, right? So
Yes.
this,
For that, I would also tell the investigations like X-ray to check for megacolon,
yeah,
and, and I will also get CT. Yes.
ultrasound first and then CT. Okay, if time would have allowed you, how would you have completed your history?
I would have. I think I have missed in the.
Ice and then expectation and then a concern and expectation and then anything else you've missed?
Yes. I would restate what patient has told me and asked him if I have missed anything.
Okay, but before that, systemic review, respiratory
Yes, I
malignancy,
missed
and
this.
yeah,
Yes, I missed
and any
systemic.
joints systemic feature like asking about the mouth ulcer, fever, painful eye, or the joints or the back pain.
Yes, ma'am. Yes. Thank
Right,
you.
good. Right, and if did your patient state that patient is having abdominal pain?
I don't think so. I don't.
Yes, if patient has abdominal pain, then whole history of abdominal pain is also or needs to be done, right?
Okay. Okay.
Okay,
Thank you.
good. And did you ask the patient if it's just the fresh blood or it's the clots or
Yes, I
mixed
asked.
with the,
He said sometimes there are clots, but it's
okay,
mostly blood.
right, good. Thank you. And any family member you asked, okay, social history. All right, okay, everything
I
else
asked
was
almost
covered.
everything,
Yes,
maybe only this
yes,
IBD part. Is
yes,
any joint pain, then any
yes,
ophthalmologic symptom is
yes,
missed. Or
yes,
this mouth ulcer part, yeah. But
yes.
otherwise, everything he mentioned.
Everything was covered. Very good. Thank you.
Thank you, ma'am.